All right, preparing to live stream.
This meeting is being live streamed. It says it is. So shut up. Got it. Yeah. So you're live. Fabian, you monitor the YouTube channel?
Yeah, I'm on it right now to see when we're popping on. It's not on us yet, but I'm.
Yeah, but there's a couple seconds delay.
Right.
All right.
Who's letting in?
Yeah.
Diallo, you're letting in the people?
Hold on.
No, I'm not saying let them in. No. I think I better let in some people. They averted it, but I just want to know who is.
Letting people, I'll let them in. I'll let them in. I just think.
All right.
No.
We're live. We're live now on YouTube.
All right. So you have the YouTube. I'll go and stream it on and mute the sound on that platform. So make sure you think that create a loop.
Yeah, we are on. We're live now.
Oh, no, you're confusing me now.
As far as being on screen,
what's that, John?
No, so you're confusing me now.
No, he's monitoring the YouTube channel, but I'm saying he needs to make sure that the YouTube channel is muted. He does monitor the chat there. It's which is text. Whereas if you have the audio on the YouTube channel, and the YouTube channel is delayed, it creates a feedback loop, which will kill the presentation.
Can you stop sharing screen a second for me, please? We're going to start.
Okay.
Just a yeah.
John?
I'm coming. Right, so admit folks. Need for.
No, John, if you make us host, we can let in people in.
Yes,
I'm sorry. You know me, I am now in crazy mode where I am not understanding.
Right. I think I can make a co-host. Yeah, let me go to that.
I'm trying to get the screen to show me the participants, but I'm not seeing it. Hold on.
You don't start it. We're setting up, so they're not letting anybody yet. So that's how tight. We'll let you. Are you in the waiting room?
Some people are in.
Yeah, the host will let you in. Just finalizing something.
I was asking David to stop sharing his screen. David, can you please stop sharing the screen? At the top of the thing, but stop share.
I see new share.
John,
pause share.
Can you ask persons to close the mic?
Oh, mute people. That's why you're having that feedback. Can folks please mute themselves? I'm looking to see where I'm to mute them. I want to be able to mute.
Somebody has music playing in the background?
Yes, I'm trying to find out how to mute. Mute all. So that will end up meaning I'm going to mute you too. So that mutes everybody. So I will unmute. And then I'm going to have to ask you guys to unmute when you're ready. So David, unmute for me, please.
Okay.
Thank you. Jean, unmute yourself, please, Miss Jean. Thank you. I guess Diallo and Fabian, you guys need to unmute.
Dr. Ratri, make us co-hosts, myself and Diallo. We're still not co-hosts.
Co-hosts, there you go. Where's Diallo? Diallo. Co-host, okay. All right, good now? Is that okay now?
Yes, we're good now.
So just tell us when you're ready and we can let in persons for you, John.
All right, yep, I think I'm ready now. I'm not seeing myself, but I think already. Here I am. All right, all the speakers, please make yourselves, unmute yourselves. And no, don't let in any more people. Okay.
All right, well, I guess it's okay now if you're ready.
Not letting in anybody. We can start. Ready to start? Yes.
Whenever
All
you
right,
are.
so I'm going to record.
Eh?
It's being recorded. I'm recording. Good afternoon and welcome one and all to this, the Jamaica Association of Sports Medicine Keeping Pace session. This afternoon, we will be looking at keeping our athletes healthy, mind and body. And we have speakers who are going to be focusing on those areas. So we're going to be having Dr. David Hanson, who is going to be looking at exercise and how the mind or conscious effort can influence what we do, or how exercise influences our activities, our mind, what we do, our relaxation, our focus. Then we're going to be looking at the area of teeth, dental hygiene. Keeping a smile. Keeping a smile is not only important for our normal day-to-day activities, but it may also have an impact on athletic performance. And this is going to be presented to us by Dr. Theon Jones. And they are going to be followed up by looking at massage, sports massage. All our athletes like to have a massage, and so do we. We all know how good it feels just to have somebody rub our shoulders at the end of a day. So our sports massage therapist, Yvonne Foster, is going to be talking about the role of sports massage in sports medicine. To start our meeting off on a good and sound note, we're going to ask everybody just to take a position of reverence as I do the opening prayer. This is the day the Lord has made. Let us be glad and rejoice in it. Thank you for bringing us together today to embrace the knowledge that will be shared with us from our learned group of speakers. May we also remain cognizant of the impact of the coronavirus has on our country and do our part to influence change, to encourage people of all ages to get vaccinated, as well as to reinforce the COVID-19 measures to wear your mask, keep socially distanced, and sanitize frequently. As we start this educational session, open our ears to listen, our minds to retain what is being taught. We ask all these things in your name, Lord Jesus. Amen.
Amen.
So welcome again, and let us start. I'm going to ask our moderator, Dr. Julianne Simpson, to start by introducing our first speaker, Dr. David Hanson. So, Julianne.
Good afternoon, everyone. Our first presenter this afternoon hails from the cool hills of Manchester, but he spent parts of his childhood in Hopewell, Hanover. After enduring and overcoming the common entrance exams, he attended the Cornwall College for 4 years and ended his high school years at Manchester High. His leadership skills shone here as he was elected deputy head boy. He moved on to the College of the Ozarks in Missouri, USA, where he represented the Foreign Students Association in soccer and was not on one, but 2 dean's lists from sophomore to his senior year. Naturally, he graduated cum laude in 1986. He commenced medical school in 1988 and graduated in the class of 92 from the University of the West Indies, Faculty of Medicine. He worked as a general practitioner for 14 years in St. Elizabeth. His love for sports never faded. He went on to complete his master's in sports medicine at the University of the West Indies in 2014. And he also works with the Peace Corps as a medical officer. He is currently the president of the Central Chapter of the Jamaica Association of Sports Medicine, and he provides medical care at various national events. He has also traveled with both senior and junior national teams. He's married and has 2 children, and in his spare time, he loves doing repairs to his home, office, and vehicle. We're speaking today on the history of sports and exercise and medical research and how that has unraveled the mystery of how exercise is coupled with health and well-being. Dr. Hanson.
Thank you very much, Jody. Let me share my screen. All right, does everybody see that okay?
Clear, clear.
Yes, that's good.
Okay, all right. Thank you very much for that kind introduction, Julian, and thanks to the JSM for asking me to participate in this exercise. Today, I'll talk about exercise and good health and how those two are coupled. A lot of us know about, we would often speak about the adrenaline rush, or we would speak about the runner's high, or we talk about the endorphins that are produced when we exercise. But with recent developments, we are more aware now that there's more to it than just that. Now, I'm having a problems scrolling my slideshow. Joan, can you scroll for me? Or I'm not sure what's happening.
Doc, what are you using to scroll? Are you using your arrows or the mouse?
The arrows.
All right. It should scroll when you share screen.
Touch the presentation
Tries the mouse.
once and then
Press
try
what? I'm not hearing you.
No, just touch the screen, the presentation once and try to scroll again. Sometimes it gives a little delay.
Right.
All right, I'm on new share.
No, you don't need to go to new share.
Huh?
You don't need to go to new share, Doc.
Just touch the presentation once. Okay, all right. So yes, I am from the Central Chapter of Jamaica Association of Sports Medicine. In this presentation, I'll talk about the evolution of exercise and wellness research, how exercise and its coupling to the immune system works. We'll talk about the dosing of exercise, how we classify that. Then we'll get into the benefits of moderate exercise, talk about exercise and immunometabolism, which is an emerging area of research. We'll talk about chronic diseases and how the immune system is involved in that. Then we'll talk about prolonged vigorous exercise as opposed to moderate exercise and how that affects our immune system. Then we'll move on to how we counteract those effects, because a lot of that applies to our elite athletes who have to be traveling to Diamond League meets all over the place and being subject to various conditions as they travel. So two significant areas of development have affected how we research sports and exercise medicine. One is at the molecular level, where we have developments in research technology, and the other is the research approach that is now used to conduct that sort of research. And then we'll talk about a little about cellular biology and the contribution that flow cytometry has made to sports and exercise medicine. So as far as molecular biology goes, we start with what we all know about James Watson and Francis Crick, that they unveiled the concept of the double helix of DNA and the fact that that is where our genes are stored, and that is what determines how we appear, our bodily functions, the genes we inherit, the traits we transmit to our offspring. And that was from 1953. In 1965, James Watson published a book about the molecular biology of the gene and essentially outlined how you went from gene to structural protein, functional proteins, and metabolism. By 2003, we had essentially quantified and characterized the genome of the human species. So that suffix "ome" refers to complete. And when you attach gen to it, or gene, it means complete quantification and characterization of the human gene pool. So the human gene pool is characterized and quantified, and it consists of 23 pairs of chromosomes, 20,500 genes, 3 billion base pairs. And we now know too that the mitochondria, not just the nucleus, has chromosomes in it. And this basically outlines what we know now. So it started with genomics, meaning quantification and characterization of the DNA and the genes we have. But in doing that research over 50 years, which costed billions of dollars, techniques were also developed to quantify and characterize the RNA species that are involved in decoding the DNA and transferring it to the ribosome for interpretation, quantifying and characterizing the structural proteins and lipids that are in a biological system, the metabolites that result from biological processes that take place in that biological system. And that biological system might be a cell, it might be tissues, it might be an organ, it might be a total organism. What this now is classified as is multi-omics, and you'll hear that term being used a lot these days, especially in research regarding things like COVID, the development of the vaccines, and many other areas of research, right? So they have now developed techniques that can quantify at the molecular level from the gene to the metabolites that are generated by what is dictated from the genes. And they are now focusing on the gut to quantify and characterize the microbiome that is in the gut and how that affects wellness and health and that sort of thing. All right. So this is just a summary of how research takes place now. So you have a biological system, you may observe something in this system that you want to research. In the old days, we would read around the topic, we would come up with a hypothesis, we design experiments to prove or disprove the hypothesis, and then we would proceed from there. All of that has changed. Now a systems biology research model is being used. And with systems biology, you're not only studying one process as it occurs, you are taking a panoramic view of the whole biological system and all the processes that are taking place within it. And using multi-omics, you can now map all of those things that are happening from the gene to production of the metabolites. So you start with data collection using platforms like liquid chromatography, gas chromatography, nuclear magnetic resonance. Powerful data analysis and processing tools are now used, so we have linked with information technology, and they're using that information, processing the data to produce more than one hypothesis. These hypotheses are then developed into simulations using software that is available. And these software now produce spatiotemporal representations. Sometimes they're actual animation movies and it converts the information, the raw data now, into computable models of cellular function. So it can outline and diagram a cellular function from you. We also have nowadays data banks that have information about the metabolites, about the RNA species, about the genome, about the proteins, about the lipids, right? So here we have the website for Metabolomes, and you can see from the list there that it covers a wide range of things. We also analyze lipids, and in this particular instance, they have studied, I'm sorry, but the top of my screen is obscured by the menu, but they studied people who were involved in prolonged intensive exercise and how that affected lipids in the blood. And you can see here, each circle represents the amount by which that lipid changes. So for example, if we look at acetylcarnitine, you can see that with prolonged exercise, it changes by less than, probably about threefold. If you look over here at glycerol, with prolonged exercise, glycerol changes by about a little less than 12-fold. If you look down here at myristate, that changes by a little less than, if you follow the circle around, 8-fold. So now you can map and see how lipids in the blood change in response to various levels of exercise. Proteomics covers proteins and genes, and this one is particularly interesting because you have two websites here. The first will talk strictly about proteins. So if you are doing research, you have a particular protein that you have isolated and you want to find out about it, you plug that protein into this website and it tells you what its role is, what the structure is, how it interacts with other proteins. String stands for search tool for the retrieval of interacting genes and proteins. And this particular one is very, very good because you can use dried blood spot finger prick samples to study 800 proteins. So you can take this out into the field, you can prick the finger of the athlete at various points in the exercise program. You can store those, it's very stable, and you can take it back to the lab and you can find out from going into these websites how genes and proteins interact when exercise is introduced as a stimulus. And this is what it produces. So this is from the dried blood spot sample of some cyclists who had cycled 2.5 hours at 70% VO2 max. The particular protein of interest is at the top. And you can see here that by triggering one other protein, it starts a whole cascade of other processes. So it's involved in regulation of the inflammatory response. It's involved in platelet degranulation. It's involved in breakdown of proteins, and the list goes on, right? So this is all available to any researcher online now, and people from all over the world contribute information to this database and make it available to the rest of the world. Flow cytometry acts at the cellular level now, and it measures the physical and chemical characteristics of cells. And the typical one will measure about 15 to 20 parameters about a particular cell, whereas the more powerful ones will measure more than 50 parameters. So you get identification and the characteristics of a cell down to the molecular level at this point. So it talks about cell size, membrane integrity, the abundance of biological active molecules within that cell, the cell structure and the cell morphology, and many other things. This became more available on a wider scale during the 1980s when HIV came on the scene, because more and more universities started acquiring flow cytometers in order to monitor the CT4 cells that are used to monitor the efficacy of treatment of the antiretrovirals. The researchers, sports medicine and otherwise, got hold of these flow cytometers and started applying them to their particular research. And this is just a rough outline of how the flow cytometer works. Basically, each cell, this is a single cell column, and each cell that passes along the stream is hit with a laser beam. And just like light hitting a prism, the cell breaks the laser beam into its various wavelengths. And this is then detected by detectors placed in and analyzed by powerful software again, and produces research information that is used. Now, exercise, like any other therapy, involves dosage. And the type of exercise that is used in research may be moderate intensity or high intensity. Those tend to be the ones that are used. The duration is also important because you're talking about workload. So short duration exercise would be 45 minutes to an hour. Long duration exercise would be 90 minutes to 2 hours. And there are subjective and objective ways of measuring exercise intensity. So if you use the perception of intensity method, it is subjective. And this involves moderate exercise where it involves your quickening of the breathing. You're not quite out of breath. You break a light sweat within 10 minutes and you can converse, but you can't sing. With vigorous exercise, you have deep, rapid breathing. You break a sweat in a few minutes and you may utter a few words at a time, but you have to pause in between to catch your breath. The objective methods of doing this, you use maximal heart rate. So maximal heart rate formula is you take away your age in years from 220. Moderate exercise would be 50 to 70% of the maximum heart rate. So you'd multiply 220 minus your age by 0.5 or 0.7%, or 0.5 or 0.7, not percentage. Vigorous exercise intensity, you would do the same calculation, but now you would be multiplying by 0.7 to 0.85 to get the range of vigorous exercise.
Let me give me now, Steve.
Using the heart rate reserve would be the maximal heart rate minus your age, which would be, 220 minus your age. And then you take from that your resting heart rate, which should be between 60 and 100 minutes. Your heart rate reserve would therefore be the maximal heart rate minus your resting heart rate. To classify it as moderate exercise, to know what your goal is for moderate exercise, you would multiply that by either 0.5 to 0.7 times the heart rate reserve plus the resting rate to give your average target heart rate zone for moderate exercise. For vigorous exercise, it would be 0.7 to 0.85 times the heart rate reserve plus the resting heart rate. And that would be the objective way of measuring intensity. Now, as far back as 1902, Larrabee made observation from tests he did on the blood with Boston marathoners. And his conclusion was that with exercise that goes beyond normal physiological limits, you get what he considered a leukocytosis of an inflammatory type. With current research, we know that the benefits and risks that are associated with exercise are mediated through the immune system, that the magnitude of immune response is a function of the physiological stress that is imposed as workload, and that the immune system relies on metabolic shifts for its activation, regulation, and deactivation. Using flow cytometry and multiomics, we now know that with moderate exercise, the white blood cell count numbers and function respond to exercise in a biphasic manner. So in phase 1, during exercise, the white blood cell count actually rises. And in phase 2, which is 1 to 2 hours post-exercise, the numbers actually fall and then they normalize afterward. In addition to that, white blood cell function is affected. So during exercise, you have proliferation of white blood cells, you have increased killing capacity of those cells, you get an immune response which involves the cytokines. And all of those increase during exercise. But again, during phase 2, in the post-exercise period, these changes fall below the resting levels and then they return to baseline afterwards. And a lot of us from studying sports medicine know, recommend that in the post-exercise period, there's a certain way to replenish your glycogen stores but we thought of it mostly as restoration of muscle and liver glycogen. We didn't realize that there was some immune response involved in all of this as well. So a new field has emerged out of this called exercise immunology. And it talks about exercise, your immune system, and the aging of that immune system. So what we now know is that during that post-exercise period, you have deployment of white blood cells to the lungs, to the skin, to the Pierce patches in the intestines, to bone marrow, to kidneys, to brain, and elsewhere. They carry out surveillance and search and destroy exercises, and they kill tumor cells, pathogens, and also dispose of aging and dying immune cells. You also have what is called hematopoiesis, which is production of new blood cells to replace the aging lymphatic tissue. And what is recommended now is that you should be doing at least 150 to 300 minutes per week of moderate exercise, because with regular exercise, you begin to get adaptations that boost your immune system and boost your metabolic response and maintain good health. And this is just a summary of what we spoke about, where regular exercise triggers the immune response and hematopoiesis. And in the end, it reduces your pathogen load, it reduces the tumor loads, it lowers systemic inflammation, and it produces good health. And there are adaptations that take place within the major organs. So you can see the liver is affected, the pancreas, the heart, the blood vessels, muscles, and adipose tissue. And in the end, if you look at the bottom, you will get reduced insulin resistance, reduced type 2 diabetes, reduced fatty liver disease, reduced cardiovascular disease, reduced metabolic syndrome, reduced obesity, and reduced mortality. So how does this all unfold when you exercise? We now know that there are substances called exokines, some of which we are familiar with. And the exokines are what couples exercise to cardiovascular health, wellness, and optimal immune function. They are really a diverse mix of substances. There are amino acids, nucleic acids, RNA species, cytokines, and metabolites. And they come from the muscle cells, liver, brain cells, kidney, and other tissues during exercise. So exercise is a stimulus that causes secretions to occur of these exokines. They are very potent even at small concentrations, and they may act within the tissue that secretes them, which would be autocrine. They may act on tissue that are next to them, which would be a paracrine function, or they may act as hormones or endocrine entities where they are secreted from a gland into the blood vessels and transported elsewhere for their effect. Essentially what they do is they affect metabolic shifts in the mitochondrial function and shift metabolism from pro-inflammatory to anti-inflammatory pathways. We now know that there's a whole lot of crosstalk between the organs in your body when you exercise. And that crosstalk or networking is mediated through the exokines. And you can see from this diagram, the muscles will secrete several different exokines when you exercise. That has its effects on the liver, the pancreas, the blood vessels, adipose tissue, and other organs. And that crosstalk is what leads to adaptation and good health. This is another diagram which shows you how exercise affects neurological function, so that you can see when you exercise, the brain itself has an autocrine effect, so it secretes BDNF. The liver produces hepatokines. The fatty tissue produces certain exokines. Muscle secretes certain exokines. Bone secretes certain exokines. And all of these combine to protect the brain, to provide functional neuroplasticity, structural neuroplasticity, improve cognitive function, reduce depression, and reduce anxiety. And this is just a list of the some exokines. I just wanted to point out two that just to demonstrate how well these exokines work. So this exokine is IL-6, which is secreted from osteoblasts. Those are bone cells, secreted from the lining of the blood vessels, macrophages and T cells, which are immune cells. They act on the muscle to increase glucose uptake and increase fatty acid oxidation, which is anti-inflammatory. They also act on fat. They act on the intestines and the pancreas. They act on the liver. They act on the intestines and the pancreas to induce glucagon-like peptide secretion. And look at how many different organs that GLP-1 acts on. It affects the pancreas, it affects the lungs, the brain, the tongue, the heart, stomach, fatty tissue, muscle, bone, kidney, liver, and pancreas. So it has wide-ranging effects. If we look at IL-5, which comes from monocytes, which are a type of blood cell, IL-5 is induced by exercise from in monocytes, and it acts on the brain to have an effect where brain-derived neurotrophic factor is produced, and that reduces anxiety, depression, and it improves cognition. You have FGF2, which is secreted from the basement membrane of tissues and blood vessels, which also act on the brain. And again, it improves neurological and cognitive function. Moving on, we have another field that has developed called immunometabolism. And this is, so again, I refer to that post-exercise period where we thought we were just dealing with restoration of muscle, storage of glycogen in the liver and the muscle to prepare for the next round of activity. What we now know is that we are also fueling the immune response, which mediates the benefits of exercise. So there are various sources of energy in the body that can be used to fuel metabolism. Glycolysis is the first one that we use. And then when glycogen levels are exhausted, we shift into oxidative phosphorylation where fat is used. Glycolysis is seen as inflammatory. Oxidative phosphorylation is seen as anti-inflammatory, and so on and so forth with the other sources of energy that we can use. What we now know is that exercise changes the inflammatory biomarkers, and these are some that are listed here. And this is just to summarize the difference between glycolysis and oxidative phosphorylation and the outcome, where glycolysis is pro-inflammatory, whereas oxidative phosphorylation is anti-inflammatory and has certain benefits to it. Let's talk about obesity. Is fluff really innocent of any offense, or is it dangerous? Well, we know that it's dangerous, and I just wanted to demonstrate it with this slide. Here you have a 20-year study in 950 obese people with elevated BMIs, as compared to endurance athletes, 383 of them with BMIs of average about 23. If you look at the C-reactive protein, the resting C-reactive protein level over 20 years now, remember that, you can see that sort of C-reactive protein is an acute phase protein and is something that we use to monitor people with rheumatoid arthritis, with lupus, with even nowadays with acute infections. You monitor the C-reactive protein to check to see how your therapy is doing. In obese people, you can see that it remains almost 4 to 5 times resting levels of that seen in endurance athletes. This is a result of exercise. If you look at IL-6, which is a cytokine, it's an inflammatory cytokine. Again, in the obese over 20 years, you will see that the resting levels of IL-6 are much higher than those of the endurance athletes. So what causes this? Well, we now know that with obesity comes aberrant immunometabolism. So the hypertrophic adipose tissue triggers glycolysis and an inflammatory response. And that leads to production of tumor necrosis factor IL-1L, IL-1 and IL, these are cytokines. The levels are higher than normal. It leads to insulin resistance and eventually to development of type 2 diabetes. In cardiovascular disease, where you have oxidized low-density lipoproteins, which are the bad fats, as we commonly call them, these are absorbed by macrophages. It triggers the glycolytic response. They form foam cells, and these foam cells have an inflammatory effect on the blood vessels walls, leading to plaque formation and eventually to cardiovascular disease. So obesity brings with it a perpetual state of activation and infiltration of the macrophages and granulocytes into the hypertrophic adipose tissue. And that leads to dysregulation of the inflammatory response. Whereas with fit individuals, you get an anti-inflammatory response. So you get improved regulation of the inflammatory signaling pathways. You get release of muscle myokines with increased IL-1RA and IL-10, which are anti-inflammatory. You have decreased dysfunctional adipose tissue. You have improved oxygenation, improved innate immune function, and improved oxylipin balance. The oxylipins are a product of fatty acid metabolism, and they help to regulate the inflammatory response.
Sorry, David, you there to wrapping up
Yeah, soon.
soon?
Just to look at this curve as it relates to athletes, this assesses your respiratory tract risk for infection as you move from a sedentary lifestyle to a more active lifestyle. And as you become more and more active, you can see your risk for upper respiratory tract infection falls by about 40 to 50%. But as you go through moderate exercise and start bordering on heavy exertion, you begin to lose the benefits and eventually you get an increased risk. This is important in our elite athletes because it is thought that it's not just the workload that is involved in putting you at risk, but competitive events, repeated cycles of unusually heavy exertion, lack of sleep, and all these other factors that they have to deal with puts them at risk when they are going to events and you want them to perform at their best. So the IOC has done studies on this. This is just a brief summary of what they have found. And what they recommend is that you have workload management. So it may be internal, hence the need for psychological counseling from sports psychologists. There should be external load management, the usual things we talk about now, even with COVID around. And then you talk about training and competition load management, which is periodization that we speak about all the time. We have also found that during exercise, you need to be taking in carbohydrates because that will attenuate the post-exercise inflammation. And this is a formula for how much you need to be taking in. We also should be taking in polyphenols, which can be had from dates, raisins, banana, leafy green vegetables, because they carry with them certain benefits if you are involved in prolonged exercise. So in essence, there are those of us who try, regardless of whether we are in a wheelchair or we are able-bodied. But then you have some who try to get around exercise, which is not good, and you lose the benefits of exercise if you continue to do that. And I want to thank you for listening, and these are my references.
Thank you, Dr. Hanson. If there are any questions, can we raise or in the chat, and you'll be acknowledged, and then you can unmute your mic and ask your question. No questions. It was all straightforward. Everybody understood everything.
I hope so.
Not seeing any questions yet.
I think you gave people a lot of food for thought. It's a lot to take in and understand just how the body works and the things that influence the outcomes, what we're looking for and what we hope to achieve.
We have one question from Lensworth. Is that Broomfield?
Yes.
Go ahead.
I didn't catch one of the last things you said on the impact of exercise on like respiratory or lung infection. Could you repeat that part for me, please?
Right. So a lot of studies have been done. For example, when I went with the youth Olympic team from Jamaica to Argentina in 2018. And we participated in research that was sponsored by the IOC to determine injury, the rate of injuries among the different sports and the illnesses that occurred during that period, because they want to be able to plan for these things when they are planning these events. One of the things that came out of it is what has been seen over and over again in other studies involving athletes who are traveling from all over the world to these events. They seem to be at greater risk of upper respiratory tract infections. And it is thought that several things may be involved. The workload. So going into a competition, you may have increased workload. You are traveling with people from all over the world, carrying all sorts of different viruses. Even if it's a flu virus, it may be a different strain from a different hemisphere. The crossing of time zones, the change in diet, and all of these things are all factors that are considered. And so the feeling is that you can mitigate these things by periodizing, by planning the workload, the internal workload, the external workload, training, that sort of thing from beforehand. But what happens is that when you have prolonged exercise, intense, vigorous, prolonged exercise, your immune system is actually affected by it, and it may last for days or weeks. Sometimes your immune system may not recover quickly. So I don't know if that answers your question, but the studies have shown that that is what happens.
Yes, it does. Thanks much.
And so you plan for it. So for example, Racers Track Club, I think, during the season, they set up camp in Italy in order for their athletes to be able to travel short distances all over Europe to the Diamond League. And it avoids some of these problems.
Can you stop sharing the screen, David, so that we can?
All right.
There is another question from Pauline Williams-Green.
Hello, thank you very much. An excellent presentation, Doctor.
Thank you.
And really learned a lot. What I'd like to know, you emphasize the benefits of having at least 150 to 300 minutes of moderate exercise per week.
Right.
I wanted to know if there's a differentiation between the types of exercise. You know, the usual recommendation is perhaps 2 days of weight training matched by 3 to 5 days of aerobic. But just give us a little bit more information how we could best benefit, and speak a little bit about, I know you're talking about athletes, but there are people over 60 who consider themselves athletes too, please.
Right. Well, when I speak about athletes, I don't confine it to elite athletes. In fact, we define it as anyone who has an enduring interest in exercise and activity and participates competitively. And of course, people over 65 do compete, and they have an abiding interest in staying fit and healthy. So my definition is not limited. So the excuse me, the 150 to 300 minutes really applies to aerobic exercise. But as you say, the recommendation, if you want a complete recommendation, it is also important to do resistance training, because the studies have shown that the greater your muscle mass is the less your insulin resistance, and it lowers your, naturally, because your muscle mass is higher, it reduces your fat mass, and that reduces your risk of cardiovascular disease and all these other problems. It reduces your risk for cancers. As you can see, when you do moderate exercise, your immune system is also triggered into carrying out search and destroy missions. And repeated exercise on a regular basis, it keeps your immune system and your metabolic system in tune. So both weight training, both resistance training and aerobic exercise are important, but they're recommending that the aerobic exercise should be at least 150 minutes per week. And it can't be in one day. It should be, over at least every other day, maybe 5 days for the week.
Thank you. Excellent.
Additionally, I think the American College of Sports Medicine recommends that if you're like hypertensive or 65 and over, you may want to start at about 75 or 80% of your heart rate max.
Right.
And then move up after you have sort of gotten accustomed, or your body has customized itself to that level. So you start low and work.
What I would say, again, like any other therapy, overdose can be dangerous. And I have had patients, I had one particular person, young girl, she was in the habit of getting up every day, putting in miles and miles down the hill outside of Mandible, going down and coming up, and then going to the gym for hours to lift every day, right? Well, naturally, she ran into problems because she started having myositis, painful muscles. She started spilling myoglobin in the urine and all this sort of thing because she had overdone it. So regardless of your age, you have to dose exercise carefully, because you can hurt yourself by overdosing on it.
Thank you. I hope that answered your question. We have another question from Paul Kidd.
I think we have to move on to the next item. We're behind. Our sponsor from Abbott is having a bit of problems with his internet. So if there are no other, if there are other questions, we could hold it. A very short well, hopefully a short answer to the question. Go ahead.
Okay, David, thank you very much for that lovely presentation. Very enlightening. Very quickly, is there any, if there's anything akin to the legacy effect as you get with treatment with diabetes? For example, a person who has been adequately and optimally exercised for a period of time, and then for whatever reason stops. Is there any continuation of the benefit, and for how long? Is there anything, any information on that?
I haven't come across any, based on that scenario, I haven't come across any studies that have addressed that. No.
All right.
So something to look into,
more
perhaps.
questions, then we will move on to the sponsor presentation. Thank you, Dr. Hanson.
You're welcome.
All right. I'm asking Dr. Jean Williams Johnson to come in here now. We will have to wait a bit for Paul Russell to link up. He's having internet issues, so if we can move on to our next speaker. Is Paul
I'm on now.
Paul
Yeah,
is here.
I'm on now.
Oh, okay.
Yes, yes.
All right, so we can have the presentation.
Okay, so can I start sharing now?
Please go ahead.
Are you able to see my screen?
Yes, Paul. We've seen
Okay.
it quite well.
Right.
Well,
okay.
welcome. Thank you for being here.
Thank you. Thank you for having me. I must apologize for my late joining. My internet was all over the place today, but thank God it has settled down. So I'm able to do my 5 slides with you. Just taking the opportunity to thank you again for allowing me to speak and to present on my products. So today I'm going to be showing you 2 quick products and a quick reminder. Ensure Complete has been around for a couple of years. It came off the market, reformulated, and it's now back on the market. And as the name suggests, it's Ensure Complete. It covers quite a bit of situations. You get 30 grams of protein. Previously, it had 20. It now has 30 grams of protein for muscle health. Good quality protein as well. For digestive health, we have 4 grams of fiber, and the fiber blend is insoluble fiber along with prebiotic fiber. For your heart health, we have plant-based omega-3 fatty acids, and this Ensure has the highest levels of vitamin D and calcium of all our Ensures for bone health. So this is the newest kit on the market, and it's now available through supermarkets. We're trying to get it into pharmacies as well, but definitely at your supermarket you'll find it. And it's distributed by Canada. It comes in 2 flavors right now. No, 3 flavors: strawberry, vanilla, chocolate, and it's a 10-ounce bottle. So that's good to know. For persons who do need calories and do need the support, as I mentioned, for whatever ailments you may have. So this now completes our portfolio. As you can see from this chart, we have Ensure Complete, Ensure Original, Ensure Plus, Ensure High Protein, Ensure Max Protein, and another new player is Ensure Plant-Based Protein. Ensure Plant-Based Protein is 100% plant-based protein. No soy, no dairy. You're getting your protein from fava beans and peas. No artificial sweeteners. That's 20 grams of protein. It's only 180 calories, and there's 5 grams of protein. I've tasted it myself. It comes in vanilla and chocolate. I've had the pleasure of tasting both, and it really does taste creamy and nice, but it's not milk-based. And this came on the market, and in one day, believe it or not, it was sold out. Whatever we brought in was totally sold out. Caramed has quickly put in an order, and they will be on your shelf by the end of September. So look out for it. Ensure plant-based protein shake. And while I have your captive attention, let me just quickly talk about your diabetic presentations, Glucerna shake and Glucerna hunger shake. And as you can see there, they're both 180 calories. But the difference being they have higher, Ensure shake has 10 grams of protein, while the Glucerna Hunger Smart has 15 grams of protein. Clinically proven not to spike blood sugar levels. And it comes in delicious flavors, vanilla, chocolate, and strawberry. And this is our Glucerna profile for your patients who may have diabetes. And if you have clients or patients who are having problems with wound healing, remember that we have Juven that comes in sachets. We now have Juven out in the pharmacy. Well, what comes to mind right away is Fontana Pharmacy. All Fontana pharmacies carry Juven right now, and it's available in packets of 8. You don't have to buy a case again from Caramed. It does come as packets of 8, and you can buy as needed. All driven by the components arginine, glutamine, HMB, which is a metabolite of leucine, hydrolyzed collagen protein, and it has your antioxidants, vitamin C, E, B12, and zinc. Two sachets a day has been clinically shown to support wound healing in as little as 2 weeks. I've included my business card. As you can see, my cell number is there, 489-6093. And you can email me with questions if you so want to at paul.russell. Remember, the Russell has 1 L at abbott.com. And 1 L because there are 2 Paul Anthony Russells in Abbott worldwide. So unfortunately, I have to be the one without the second L. So thank you again for the opportunity to share with you. And feel free to field questions, call me, or you can send an email, and I'll respond to you as quickly as possible. Thank you very much.
Thank you, Paul. Thank you, Mr. Russell. Are there any questions for Paul regarding the products that he has mentioned?
You can put the questions in the chat, and I will, and I'll try.
David,
I'll try and get to
Dr. Hanson had something that he wanted to. You wanted to ask a question, David?
Yeah, I just wanted to find out from Paul if there was a line for cancer patients. You have a line of products for cancer patients, nutritional line.
What has been happening is in the United States, they've been using Ensure Complete, which is tackling the calorie issue, tackling the fact that giving you high quality protein, and they've been addressing it from that standpoint, because many of your cancer patients have been coming into the hospital or the institutions malnourished, weak, needing protein, needing calories. That has been how it has been handled in the United States. We don't have a specific Ensure for cancer per se, but we have been using Ensure Complete, both locally and overseas.
Okay.
All right, great. Thank you very much, Paul. Thank you very much for Abbott Nutrition for bringing us all that information, that very worthwhile information. So we're moving on now to our second speaker, and I'd like to introduce Dr. Jean Williams-Johnson, who is going to be introducing our next speaker.
Thank you, Joan. Good afternoon, everybody, and so happy to have you all with us this afternoon. And it is indeed a pleasure for me to introduce to you Dr. Theon John Jones. Dr. Jones is a Jamaican national who graduated from the Knox College in Jamaica in 1978. And then he went overseas to pursue his undergraduate education at the University of Nebraska in Lincoln, USA. from which he graduated with a degree in life sciences in 1983. He then entered the Howard University College of Dentistry in Washington, D.C., and he did a degree in dental surgery, which he completed in 1987, and then he returned to Jamaica shortly thereafter. Dr. Jones has been gave yeoman service to the government of Jamaica's Ministry of Health from 1987 to 2011. First, he was a dental intern attached to the major trauma institution, if you like, the Kingston Public Hospital. And then as a dental clinician, he was attached to the government's dental clinics in central Jamaica. And then from 1996 at the Dental Auxiliary School in Kingston, where he trained dental therapists, dental assistants, hygienists, and technicians. He served as a lecturer and clinical and laboratory supervisor, and then he combined those duties to become the school's director, a role he held from 1998 until July of 2011 when the school closed. Dr. Jones served as a member of the Dental Council of Jamaica from 1999 to 2011, and he also served the Joint Committee of Tertiary Education of the University Council of Jamaica as a member for a term. Dr. Jones joined the Faculty of Medical Sciences, the University of West Indies, Mono, in August 1st, 2011. He has been the director of our dental school since 2011, a post he has carried out with great distinction, and he has had the inaugural graduations of various dentists since its inception. Quite a feat for a new program. And he also sits on various committees, including the heads of department committee, the Evaluation and Promotions Committee, and the Curriculum Management Committee of the University of the West Indies Faculty of Medical Sciences. Dr. Jones has interest apart from dentistry and dental education. He also is interested in jurisprudence, I suppose, as related to dentistry. He's also interested in simulation. This has become increasingly more important as we have to learn to train our students in a COVID environment. He's interested in forensic dentistry and social accountability in the specialty. Dr. Jones is also the brother of our president of the Association of Sports Medicine, Dr. Gwyn Jones, and we're indeed happy to have him. And it's a pleasure for me to invite Dr. Jones to speak to us on Teeth, Performance, and You, a guide to the sports medicine practitioner. Over to you, Dr. Jones.
Okay, thanks, Madam Moderator. I'm going to start to share. Okay, thanks, Madam Moderator. Thanks, Dr. Ratri, for the invitation. It's always interesting to hear one's bio sketch, and it does bring a smile at times when you remember, and I remember. So thanks, Dr. William Johnson. So good afternoon, colleagues. Today, we want to take you on a journey, a short one, and that journey, as said by the moderator, is entitled Teeth, Performance, and You. We want to start with some of the research that has informed the presentation. The first one was by Sunstar Foundation. They funded the research. It was actually done at London 2012, where they looked at 302 athletes from 25 sports. The athletes were from Africa, the Americas, and Europe. And out of the 302, they were able to use data from 278. These were the athletes who attended the dental clinic at the London Olympics, which some of you who are present may have been present. So their findings, they found that 55% of the athletes had dental caries of the Olympians, 45% had dental erosion, and in terms of periodontal disease, 76% had gingivitis and 15% had periodontitis. They also found that more than 40% of the Olympians were bothered by their oral health. 28% of them said it affected their quality of life, and 18% said that it affected their training and performance. They also found that nearly half of the participants either had not had a dental examination or received dental hygiene treatment in the previous year. So overall, their findings were that there were high levels of poor oral health among these 302 Olympians. The second study was done by Eastman Dental Hospital. They studied elite athletes. They screened over 350 male and female athletes from 11 Olympic and professional sports in the UK. And at the time, this was the largest and most comprehensive study ever conducted. The mean age of the participants was 25, the range was 18 to 29, and there were 67% of them were male. So what were their findings? 49% of them had untreated tooth decay, 77% had inflamed gums, 32% said that their oral health had an impact negative on their performance. They also found that 34.6% had difficulty with eating, 15.1% had difficulty sleeping or relaxing, and very importantly, 17.2% felt that their bad oral health had negative effects on smiling and self-confidence. Even more interesting, 1.1% had excellent periodontal health, 87.5% had gingivitis, and 21.6% had periodontitis. In that study, 39% experienced bleeding gums while brushing their teeth. And one of the authors, Needleman, he said that every sport examined revealed significant levels of oral ill health, with the overall risk of tooth decay being higher for an elite athlete than the general population. A third study was done by the Cardiff University School of Dental Medicine. They did a survey of sports drinks consumption among adolescents. So they polled over 160 children between the ages of 12 to 14 years in 4 schools in South Wales. And what did they find? They found that 89% consumed these sports drinks, 50% did it socially, 90% did it for taste, 33% did it for price, and only 18% drank it for athletic purposes. And the study made the point that these sports drinks are not targeting adolescents, yet they found themselves consuming them to a level of 9 out of 10. And then we move to the fourth study by the Oral Health Foundation. In their study, they again looked at sports drinks, but from a different angle. And what did they find? They found that these drinks produced measurable loss of tooth surface. The dental enamel was lost, and the dental enamel was softened to between 30 to 50%. Now, especially arising from the Sunstar Foundation funded study, there was a collaboration between Sunstar and the International World Dental Federation. And in this collaboration was produced guidelines for dentists and sports medicine physicians. So we want to acknowledge this guideline from which we'll be extracting information for the presentation. And we also want to acknowledge the Dentistry Today publication from where the source material for the research studies has been taken. So what has the World Dental Federation guided us on? Firstly, they made a definition. They defined sports medicine, sports dentistry. They defined it as a branch of sports medicine that deals with the prevention, treatment of dental injuries and oral diseases that are associated with sports and exercise. So that's the working definition that we are using for today's presentation. The focus on what they have tried to recommend is on the stomatognathing system, which is where we combine the mastication, deglutition, and speech parts of the body to include the mouth, the teeth, the jaws, the pharynx, and other associated structures. And the recommendations look towards maintaining the optimal health of mastication, swallowing, and speech. So first of all, the FDA looked at the functional factors involved in this link. And their recommendation is, in all that we do with our athletes, we want to ensure that re-establishing of the stomatognathic system is our focus. And what they look at are 1, replacing missing teeth, 2, restoring occlusal stability, i.e. doing restorations, fillings, and 3, doing orthodontic treatment. So this is an example of replacing missing teeth, where you have a span of missing teeth in the upper arch of this patient, and then they replaced it with a bridge or a denture in the lower image. And then here's the example of orthodontic treatment, where the teeth in the upper left corner are being replaced and moved by orthodontic treatment, resulting in the image on the lower right. So this is the overall functional relationship between good oral health and athletic performance that we want to spend some time on today. So what are the risk factors in sports? Unfavorable diet, stress, and that stress can be seen when you see athletes who will vomit before a match, before a game, before an event. That's an example of stress overtaking the body. Overtraining can cause poor oral health. Increasing the functional load on the teeth, i.e. there are athletes who will clench their teeth, grind their teeth at night. And something that is a responsibility of all of us in health, especially those of us in dental health, is the lack of oral hygiene education. So what are some of the dental problems that can occur because of these risk factors? 1, this is an example of what we call cervical lesions, not cavities, that can be caused in different individuals. 2, this is dental caries. Those dark areas show where caries is starting. A lot of time athletes will present and we see these dark areas that have not reached the stage where they're causing pain. These are incipient dental caries, and these can lead to larger cavities involving the pulp, causing swellings and infections, and that can contribute to poor athletic performance. And as we mentioned, the parafunctional habits is an example of a bruxer, somebody who unconsciously at night grinds their teeth, versus a clencher, who is somebody who will do that even in the days, especially when they're under stress. So one of the examples that we use when we're speaking to athletic performance and poor oral health is swimmers. Swimmers are particularly exposed to the risk of dental erosion. And this is due to the low acidic pH in most of the swimming pools. And what happens is the acid wears away the enamel, as seen in this image here, resulting in a condition known as dental erosion. And what the FDA recommends, and something for those of you involved in swimming should take as a take-home message, after swimming, rinse out their mouth with water. And do not avoid brushing immediately after swimming, because brushing will help to basically spread the acidic environment in the mouth and cause the erosion to spread through the teeth. So you tell your swimmers, when you come out of the water, rinse with water. And then we move now to energy foods and sports drinks. This is something that all athletes do, and all sports medicine practitioners do say to their athletes, you know, these will help you. But we want to, we want to caution you in how you advise them about these energy foods and sports drinks. 1, many of them have acidic ingredients. 2, they have high free sugars. And this now will again result in a drop in the pH level in the oral cavity. Once the pH drops, that's what all of the bacteria involved in forming dental caries love, because they get the opportunity now to damage the dental hard tissues, damage the dental filling materials, and lead now to more problems for the athlete. A third area of concern that you have to be aware of is medications. There are certain drugs that are indicated for dental treatment that may be transformed in the body into substances prohibited by the anti-doping authorities. One of them are the codeine-containing drugs, which will be transformed into morphine in the body. And what we use a lot of times in dentistry are the opioid drugs. We will use hydrocodone, oxycodone, And most of you will be aware of acetaminophen, which can come with codeine. And we caution against these being used in athletes because of their transformational ability inside the body. So what does the FDA recommend? It asks us to be aware of the potential indirect doping effects of dental prescriptions. So where you are a physician, where you are having athletes on medication, again, you want to ensure that the medications are compatible with physical exercise, one, and with the anti-doping policies of WADA and JADCO. So we move now to oral health and overall health. These are just some summary images to guide you. Oral health is linked to heart disease and stroke, respiratory disease, arthritis, diabetes, gastrointestinal disease, and preterm low birth weight babies. All of these have been proven by different studies. Another way of looking at the connection between oral and overall health is that if you have poor oral hygiene, first thing you're going to get is gum disease. And this can now lead again to increased risk of stroke, respiratory and cardiovascular heart diseases, weakening of your bones, osteoporosis, diabetes, erectile dysfunction, and pregnancy problems. So thus the link between the sports medicine practitioner and dentistry shows that if there's a collaboration, you will help to mitigate against this effect of poor dental hygiene. So just as a little summary, there is a connection between oral and general health. Oral health basically mirrors the body's health. A healthy mouth will lead to the athlete performing in a more efficient way. And conversely, if you have an unhealthy mouth, it's going to affect the athletic performance. Thus, again, if we can link between the sports medicine practitioner and the dentist and the dental practitioner, this will help to foster optimal athletic performance. So there are also some microbial factors involved. The oral cavity can cause infections and inflammations by going through the bloodstream and circulating toxins and bacteria. So the FDA recommends for all athletes that there should be an overall oral prevention program adapted to the patient's risks. There should be a dental treatment plan that addresses both the hard and soft tissues of the athlete. So dental caries, as depicted in this image here, and periodontal disease as linked here, can cause cardiovascular diseases, inflammation, and musculoskeletal problems. In addition, malocclusion, as depicted here, temporal mandibular jaw disorders, that's the jaw where the condyle of the mandible is articulate with the skull. Dysfunctions in this jaw joint can cause also musculoskeletal problems. It can cause challenges with developing muscle strength, with your posture, with how you gait, and just how you move about. So you have to be very careful when these are seen in your athlete. The overall impact of this is one, poor oral health will lead to challenges in your rehabilitation. The risk of injury will increase and athletic performance will also decrease. So here we have a summary slide just linking the bacterial factors and the functional factors discussed to the cardiovascular diseases, the gait, the effects on your plantar arch, increasing injury and lowering performance. So in summary, in this part of the presentation, you want to be careful. Does your athlete have dental caries? Does the athlete have periodontal disease? Is the athlete showing signs of dental erosion? And is your athlete showing signs of a condition known as tooth abrasion? So if there is this in your athlete, you want to ensure that as soon as the athlete starts to practice sports, you try to first reinforce daily oral hygiene routines because the focus is on prevention. So Jennifer Lochte, basically a publication in 2017, just listed little habits about their daily routine. Brushing, cleaning your tongue, flossing, use of mouthwash, and gum. I just want to spend a little bit of time on the gum aspect of this chart, because most of us know to brush 2 times a day. When we get up in the morning, before we go to bed at night, we must brush our tongue. A lot of us don't do that, and we don't guide our athletes to do the same. We should be flossing at least once a day. Most of us try to do it once a week or when we remember. Mouthwash is actually very important now in COVID-19, in that the mouthwash tends to reduce up to 99% of the possibility of the virus staying in the mouth. But gum, sugar-free gum is actually very helpful for athletes, because especially where the athlete is not able to brush their teeth after eating, after workouts, not able to drink enough water, the sugar-free gum actually stimulates saliva that will help to reduce the bacterial load in the mouth. So that's one area I want to stress to you, is that where you don't have the ability to brush after every meal, you don't have the ability to rinse off with water after every meal, sugar-free gum is something that is good for the athlete and you. So one of the challenges that we have is development of xerostomia in athletes. Dehydration, stress, sweating, and mouth breathing will result in dry mouth. You have certain sports like cycling, running, where a lot of times the mouth is open, that contributes to mouth breathing and contributes to dry mouth. So what does the FDA recommend? They recommend that we should have our athletes drink or rinse with small amounts of water before, during, and or after any exercise, training, match, to replace lost fluids and rehydrate afterwards by drinking water. Okay, water is the #1 recommendation. And then there are psychological factors. When you're in primary school, when you're talking about dentistry, especially when we have students coming to interview, everybody quotes the primary school adage, high school adage, that a healthy smile, makes somebody have, looks better, have greater self-confidence. And it is true. Good oral health does improve self-confidence, does improve quality of life, does improve your well-being, and there's a correlation between good oral health and good athletic performance. So here's an example of a before and after treatment, and this injury to the upper central incisor is a frequent one that occurs in sport, especially contact sports. And normally what happens is, if this is left for a long time, you will see a change in the level of confidence in the particular athletes. Where that they wanted to smile before, or they used to smile before, this fracture causes them now to either start covering up their mouth, or what a lot of persons do over time is that they train their upper lip to cover the fracture, so that even when they are talking or smiling, you're not going to see the fracture. Easily, just repair the tooth, have the tooth repaired, and helps to restore their self-confidence. So the FDA says that the guidance to sports medicine practitioners, to dentists, can be summed up in 3 words: P, S, and T. We know the adage that prevention is better than cure, and the guidance is P for prevent, S for screen, and T for treat. And we'll go through the different areas as we go through the slide. So prevent, what they're saying to you is, don't wait for something to happen to the athlete dentally before you can act on prevention. As a part of your initial assessment of your athlete, include oral health. You want to ensure that they get the appropriate dental care if they present with any problems. So act first, include oral health, and get the care that they need. That's how you'll prevent the challenges in dental care affecting your athlete. Regular checkups. These are advised for all of your athletes, with a slight difference between amateur and professionals. So for an amateur athlete, you want them to go and get a regular checkup once a year. For your elite athletes, twice a year. Next, you also want to look at the nutrition. You want your athletes to maintain a healthy diet. You want them to limit stacking on foods, limit drinking liquids high in sugars. You want them to be very careful about how they consume energy drinks. And overall, just have them limit foods that contain a lot of acids and sugars. Smoking. Smoking is something that we have pushed throughout history as not being something that is good for general population, but it's definitely not good for athletes. So you don't want your athletes to smoke cigarettes. You don't want them to use smokeless tobacco or the current craze of e-cigarettes. Overall, tell your athletes no smoking. It's going to affect the teeth also. And then protection. All the studies have shown that there's a greater risk of oral injuries for athletes than non-athletes. One thing you want to try to help them to do for protection is tell them about proper mouth protection. This is in the form of mouth guards. Mouth guards are very essential. For those of you who follow basketball, Steph Curry must be the #1 proponent of how not to wear a mouth guard. But by doing what he does, he has shown everybody that he is wearing a mouth guard. And it is something that you want to advocate for all of your athletes, especially those in contact sports. Trauma. Trauma occurs in sport. That may be because of a fall. It may result in damage to the tooth. It may damage to the bone, to the soft tissue around the tooth. It may damage your TMJ. Boxing is one of those sports where a blow to the jaw can damage the TMJ. It can actually fracture the TMJ. And what does the FDA recommend? Customize mouth guards when practicing contact sports. The FDA believes that for some sports, mouth guards should be mandatory. Other sports, they will strongly recommend those mouth guards. In Jamaica, hockey, field hockey, I think is the #1 sport where mouth guards should be mandatory. And I do know that through the Faculty of Sport at Mona, they are trying their best to inculcate that in the Hockey Federation. You know, other sports like water polo, these should be strongly recommended. And they recommend that in children where the mouths are still developing, you know, you may get a standard mouth guard, something that you buy from the store, and then the dentist can adapt it. So when we talk about customized mouth guards, what we actually mean is that the athlete would come into a dental office, take an impression, and then the mouth guard is fabricated against their mouth. So this makes the mouth guard only useful for that particular athlete, and it offers much greater protection than the ones you will buy in the stores. So the other aspect, we said prevention, now we look at screening and treating. What does the FDA say? Dental screening is mandatory for all your athletes. This should be a part and parcel of how you prepare your athletes and get them ready for each season. So there are specific things that we would do. We would look at what we call the DMFT index and the erosion level. The DMFT looks at decayed, missing, filled teeth in the mouth, and we will guide our treatment most of the times based on the DMFT. We look at the gum index, the periodontal index, to see how healthy their gums are. We look at also their occlusion, how do their teeth come together. We check the function of the TMJ. We usually ask them to open and close. And if we hear any clicks, we know something is going on that should not be going on in the TMJ. We also look at their saliva, look at the consistency. The more fluid the saliva is, the more protective it will be of the development of any dental caries. We check the facial muscles. We look at third molars to see if they're impacted, because impacted third molars will cause other effects that can impair athletic performance. We spoke to this before. Look at their nutrition, any signs of inflammation that could lead to periodontal disease. And we always check their medical history. If there are any challenges that we find, we would back these up with some x-rays. So we will do intraoral x-rays at particular teeth, extraoral x-rays that could be panoramic, they could be cephalometric, or they could be CT scans. And all of these that we will use to help us in assessing our athlete. So this is just a table of summary looking at screening and treating. And it's something that we would guide you to work with your dental person, your dentist who's attached to your athlete or team to develop, because a copy of this really should be in the possession of the sports medicine practitioner so that you can monitor and follow up if it is that the athlete does need some treatment. So in closing, I leave you with some points to ponder. 1, do you have a dental attachment with your team? 2, do you have a dental attachment with your athlete or athletes? And thirdly, is the FDI's guidance practical in your setting? So we could not close our presentation without a reference to where we are in this COVID-19 pandemic. In February of this year, a team of researchers published in the Journal of Clinical Periodontology that patients with gum disease are more likely to have severe complications from COVID-19. So again, here we have not just athletic performance being impaired, but now we see a direct link to COVID-19. So I thank you for your attention, and thanks again for the invitation.
Thank you very much, Dr. Jones. It's an excellent presentation. Prevent, screen, and treat, right? So at this point, I'd like to ask if anybody has any questions before we move on to the sponsor. Any questions for Dr. Jones? No? I'd like to ask one, taking moderator's privilege. You had said that the athletes should, if they're not elite athletes, they can go to the dentist. They're elite athletes, they go twice a year. Is this age-based? Because as adults, we're told that, you know, everybody should see the dentist twice a year. I wasn't sure what you're alluding to there.
So it depends on the health of the patient when we advise patients to come twice a year. That is standard of saying, yes, you come twice a year, but the more healthy you are, we may say to you, you only come once a year. So if your health may be compromised, we may say come 3 to 4 times a year. So what the guidance is, because athletes should have a better body condition and should have better oral health, they should really be coming once a year. But for the elite athletes, because they put more pressure on their body, we would want them to come twice a year such that we can do a more regular checkup to see if in the interval that we saw them before, especially between background and the start of competition, we definitely want to see them again before they start, to just to check to make sure anything that was done before they started their background training to get them ready is still in place before they go to perform.
Okay, excellent. Thanks for that.
I have a question for Dr. Jones. Dr. Jones, thank you for an excellent presentation. This is Dr. Jones. Question, natural means of increasing saliva and taking care of teeth. I remember growing up, we used to talk about chew sticks, and the Rastaman them used to talk about using chew sticks and so forth to clean their teeth and so forth. And you can actually get packets of them and so forth. Do you have any recommendations about chew sticks, advice on chew sticks, or any other plant type thing that we were told people could chew growing up to take care of their teeth?
Okay, so chew stick is a naturally occurring dentifrice, i.e. it protects against decay. And over time, as all of us are aware, there are many things that we have put on a shelf that our grandparents and parents would have taken from a garden outside from a bush. And chew stick is one of them. So now you can actually go to pharmacies and you can buy the chew stick as a toothpaste. So for those persons who have access to chew stick in its natural form, it is something that we recommend because, again, it's cheaper than what you'd have to go to the store and buy. And any natural product that is available is something that we would recommend because, again, we have made everything commercial, but it is good. And that's why people will know that the Rastamen who use chew stick, they always seem to have very good teeth.
Thank you very much, sir.
Yes, sir.
I have one question, Doc.
Is there another question?
Yes. Hello? You guys hear
Yeah,
me?
Doc, go ahead.
Oh yeah, man. My internet's a little unstable. Sorry. Doc, you might have mentioned it before, but what about coffee? What's the word on coffee in terms of dental health, whether athletes or anybody? What's the role
caffeine
of coffee there?
products.
All right. So
Yeah.
so coffee.
No, coffee itself, yes.
Yeah, caffeine is a stimulant. Yes. Persons use it to stay awake, be more alert, and it is not something that we recommend from a dental perspective because, well, let's put it this way: anything in moderation is good. Yes. But coffee is one of those things where we tend to go a little bit more than use in moderation. We get addicted to coffee and we use it more than we should. And the first effect that it happens with teeth is that it's going to cause staining of the teeth. Okay. That staining now gives the bacteria a nice platform on which to attach themselves. Bacteria start to attach, leads to dental caries, but a lot of times it will lead to the development of gingivitis and periodontal disease more than caries. So again, it's something that I say to my patients all the time. I don't matter what you eat or drink, I matter what you do after. Okay, so water is always my guidance to them. If something is inflamed, my guidance to them is, no matter what we have developed, warm salt water rinses in the mouth actually can do better than some of the things that we would prescribe. So again, do it in moderation, but know that coffee, tea, to a lesser extent, leads to staining, bacterial attachment, periodontal disease, gingivitis, eventually caries.
What about green tea? The green tea supposedly has health benefits.
Yes.
I can't remember if I've seen some about it on teeth. Is that the case?
Yes. So again, green tea has health benefits and is something that is a proponent of, persons in medicine, in health. Again, in moderation. That's the guidance. All of those will cause staining of teeth.
Okay.
Right? And it just depends on how much you do. Just like cigarettes. Cigarettes, when you pull on cigarettes, over time, cigarettes going to cause, that heat damage to the gums, but it also leads to cigarette staining of the teeth again, and the cycle starts over.
Okay. All right, thank you.
Yes, thank you. I think Dr. David Hanson has his hand up to ask you a question. Please go ahead, David.
Hi, Dr. Jones, excellent presentation. Two things. One, if I had to explain to a high school athlete how the state of their dental health will affect their performance, how could I put that in simple terms? That's one. And two, dental care is very expensive. And that is a serious obstacle to high school students right on up to adults. Is there any way around this problem?
Thanks, David. First and foremost, the easiest way to explain it is that if your tooth is hurting you, you're not going to be able to perform well. Simple, right? They need to understand that just as if a muscle is hurting, they won't perform well. It's the same way if the tooth is hurting. And they'll be the first to know because toothache is second to none. And when the tooth is hurting, all sense of reality sometimes escapes us because we feel that this pain, we don't know where it is, we don't know how to get rid of it, and it's going to affect us psychologically and physically. So the simple relation is the tooth is just like a muscle pain. And that's what I would share with them, is that we need to get you as healthy as possible, and that includes your teeth. Just like a muscle hurting you, if your muscle is not 100%, you're not going to perform as well, and hence we need to get your teeth fixed. The cost of dentistry must be my biggest concern in coming back to Jamaica. It is very challenging for the average person to afford dentistry, and the truth is not too many of us find a way as dentists and dental practitioners to mitigate against this expense. And especially now in COVID, where practice had to be shut down and persons are now having to recoup. Dentistry is a business. So the challenge there is, how do you find a dentist in your area who is willing to partner with you and your team and your athletes to reduce the cost? The hope was that through the government system, the government had trained dental nurses across the island, and the dental nurses' focus was on children. And the idea was that if we could prevent caries in children, then we would have a more dental healthy population as they grew up. The challenge became the dental nurses could only work on the children up to a certain age. And there was a study that was done that showed that the gains of the dental nurse were lost on the adolescent and the young adult. So the guide would be, is there a dental clinic in your area? Can you attach your school, your team, your athletes to that dental clinic and have them work with you to develop a program of prevention? Prevention is the key. And if we tend to wait too long, we tend to wait until there's pain before we bring them into the dentist. So that will be my guidance to you. Try to see if you can work with the dental clinics in your area for your school-age athletes, because that would be the best way and the least expensive, because it's free. The challenge is being free means longer waiting time. But I think that if you work as a group to say, I have these athletes from this particular school, how can we schedule them for regular treatment? I don't see where the government dental clinics would refuse that type of arrangement.
Okay, thanks.
Yes, thank you very much, Dr. Jones.
Thank you very much.
Yes, so if there are no more questions, any more hands up? No?
No, I think we can move on.
Move on. Yes, excellent. Thank you, Dr. Jones. Extremely useful presentation. It's so important to understand the link between oral health and our athletes' performance. So at this point, we'd like to invite us another sponsor who has been so kind to support us this afternoon, Ms. Ketcha Braham, pharmaceutical representative. She works with CARMED and doing the Novartis line. We are so happy to have you here, and we invite you to tell us about your products. Yes.
Hi, good afternoon, everyone. Thank you for the opportunity to share some reminders with you today. And as you said before, that I am the medical representative for the Cataflam portfolio. And I will be just doing a quick reminder shortly. Right, so of course, everyone is very familiar in sports medicine with Cataflam and Voltaren, but some of the quick benefits we'd like to highlight today will be the fact that we have a very fast onset. We have a very good efficacy. We have a good safety profile along with various presentations available. And of course, with our fast onset, we always like to remind everyone that Cataflam offers pain relief within 15 minutes of an oral administration. However, the dispersible and the liquid capsules has an onset which is even faster within 10 minutes. The suspension for the pediatric age does have a general onset of 14 minutes. And of course, we want to do a quick comparison between three of the most commonly used presentations in the adult population. We're looking at the liquid capsules, the oral solution formulation, which is also known as the dispersibles, and the tablets. So the dispersibles is seen in red, with the capsules with the green dots, and the tablets in yellow. And as you can see, we're showing the concentration of the drug within the bloodstream within a certain time frame. And it shows here that the highest concentration received within a 20-minute period is highest in the dispersible, in the red, and second comes the liquid capsules, with the tablets being the lowest. So you're seeing that you're going to get a much stronger response within the same time frame comparing the three presentations. And thus we do recommend for the fastest relief to utilize either dispersibles or the capsules, whichever is more convenient for your patient. And of course, we want to compare that same 20-minute time max to other medications that are available. Most commonly used, we have of course, the cataflam or Voltaren compared to ibuprofen, etoricoxib, and celecoxib. If I look at the first four, we can achieve Tmax within 20 minutes, 60 minutes being the longest. However, ibuprofen is anywhere between 45 minutes to an hour and a half. Etoricoxib between an hour to an hour and a half, and celecoxib can be anywhere between 2 to 8 hours, depending on the dose, as you can see here. But of course, one of the major benefits I think that we have as a molecule is our alternative mechanism of action. Here, this is a diagram that displays many of the mechanisms in how the drug acts. And as you know, we do inhibit prostaglandins, and that is one way in which we can prevent pain. But also we do inhibit the lipooxygenase pathway that inhibits substance P formation, that blocks that as a pro-inflammatory marker that is very beneficial in certain arthritic types of pain. However, we do have central nervous system mechanisms, and those mechanisms do include an influx of potassium ions in the nerve through the cell membrane of a nerve cell. It actually causes a hyperpolarization of that cell and also prevents an action potential from being transmitted. We also have blocking of NMDA and acid-sensitive receptors, of course, that will also inhibit some of those receptors from preventing pain signal transmission. So these are other mechanisms that, along with our prostaglandin inhibition, that aids in cataflam being very potent. And just to highlight the fact that we also have an increase in endorphins experienced by persons who are on cataflam and Voltaren. And of course, once you look at the safety profile, the reality is that all NSAIDs contribute, have a potential safety risk. And of course, this is a spectrum that shows the variation of selectivity, whether it's COX-1. So on the right, we have more COX-1 selective drugs, and on the left, we have more COX-2 selective drugs. Where that the more COX-1 selective a drug is, there's an increase in bleeding, ulcers, and discontinuation as a result of that. But on the right, you're seeing that these drugs, the more COX-2 selective, have an increased risk of MIs due to thrombosis, and also an increase in systolic blood pressure, also can lead to discontinuation. Cataflam and Voltaren were more of a non-selective drug, which means that even though all possible adverse events are possible, we're in the middle, and thus we don't have a significant increase in bleeding risk compared to the COX-1, or we don't have that same increase in cardiovascular adverse events compared to
Ketra, we seem to have lost you.
She's still here.
Is
she muted? I don't know what's happening. Let's see.
No.
She's not. She's not.
Oh, she's off.
She's not muted.
I don't see her on the participant.
She's
She's not on the list.
No, she's still here.
She's still here.
No, she's still there. So something probably happened to my
Connection problem, possibly.
Let's see if I can call her.
Okay.
She's having internet connections because I can't do anything to her settings. Yeah, it seems as if she gone. Okay.
Right, so can I allow her to come back on after
if
she's gonna try and come back in just now. She's gonna try and come back. You were talking about the different presentations. Okay, great. She's gonna log back in. I see her back on.
Okay.
Hi, sorry about that. Let me start over or pick up back where I left off.
Can your screen be a little bigger? It's
Sure. Let me share content. Can you see my screen?
Yes. It
Right.
can be bigger, no? I think that's
the size. Is this better?
Yes.
Okay.
Would have
So
been
as
nice.
you can, so as you can see, we have a variation of presentations. We have the dispersibles, the Cataflam 50 milligram tabs, along with the Voltaren injections, the SR75 twice a day, and the Voltaren retard. And of course, the liquid capsules, which is now available everywhere. It's easy to swallow with fast absorption and it's fast dissolving. Of course, this presentation is our favorite due to the fact that we have better GI tolerability and less complaints compared to the tablets, and it's the same cost as the tablets. And of course, we know that Cataflam is a gold standard in pain medication. It is a world brand leader with documented safety and efficacy in 40 years of clinical use with more than 100 controlled clinical studies available. Thank you. Any questions?
Great. Thank you. Any questions for Ms. Braham? No?
No.
Well, thank you very much. I think
Sorry,
we're all.
I have one. Sorry.
Oh, go ahead. Go ahead.
Sure.
Yeah, just in terms of what you presented was Cataflam, correct? Okay.
Right, and
Voltaren. Okay, right. So what are the recommended ways for increasing the absorption of the Voltaren? I know we as physios we tend to do ultrasound phonopharesis. What else can be done to increase the absorption, if anything else?
Increase the absorption of Voltaren particularly or Cataflam?
You're talking about the ML?
Sorry, the ML gel, beg your pardon. Right.
Okay,
Voltaren ML gel.
so I'm going to share with you that the Voltaren Emugel is no longer a Novartis product. We don't promote that product. It, for years, has been now a GSK product. So all the information on that is not promoted or shared by Cataflam. So I don't know if you've noticed on the box, it says GSK for a few years. So from before I even came to the company, we had no longer done that product. It's been a good while now, over 10 years. So unfortunately, I don't have that data to share with you, but I'm sure I can have someone from CariMed reach out and offer that information. You're looking for increased absorption from the gel, correct?
Right, that's correct.
Yes.
Okay, great.
That's what it is.
Yes, you can send information to me, Ketron. I'll get it too.
I will do that.
Okay.
All right. Thank you.
No more questions are there? No. Well, we're all familiar with Cataflam and Voltaren, and we're quite happy with the products. So I suspect that's why you're not getting a lot of questions. Thank you very much, and we really appreciate the support.
I think the only thing would be that sometimes you find that people athletes who have injuries, they tend to take it like sweetie.
It works, right?
Yes, because it works, always seem to have it in your pocket kind of thing.
Yeah. All right, thank you very much. I'm over to you, John.
All right, so here we go. So we're moving into the final segment of our session. So we're going to ask Mr. Fabian Miller to do the necessary introductions for our next speaker, Ms. Yvonne Foster. Fabian, yours.
All right, thank you, Dr. Ratri. Good afternoon again, everyone. I present to you Ms. Yvonne Foster, a graduate of
Fabian, we're getting some
College,
breaking up of your
diploma, the certificate.
Go
Not
again.
hear me clearly?
No, you're breaking up.
Oh, it's the my net is a bit unstable. All right.
Try again.
All right. Ms. Foster is a graduate of GC Foster College with a diploma in sports massage therapy and a certificate in fitness instruction She has a BSc in massage therapy from the National University of Medical Sciences and also holds a postgraduate diploma in educational and training from VDTI. She's also an adjunct lecturer at the GC Foster College for the past 7 years, registrar and massage instructor at the Face Place Institute of Aesthetics, massage instructor at the Hart College of Beauty Service 2017 to 2019, online content developer for NCT-VET massage therapy, chairperson for the NCT-VET Standards Review Committee for massage therapy. Some of her achievements are 9-time National Women's Table Tennis champion, participated in CAC Games, Commonwealth Games, World Championships, and Caribbean Championships as both a junior and as a senior athlete, selected to represent Jamaica at United Nations Office on Sport for Development and Peace Summit. She's also a member of sports medicine team, went to CAC Games in Colombia, under 18 and under 20, NACAT Games, San Jose, Costa Rica. And she's also the General Secretary for the Jamaica Sports Massage Therapist Association. Please welcome Ms. Foster.
Thank you, Fabian, and I'd just like to say thank you to the Sports Med Association for having me present at this webinar today. All right, so the title of my presentation for today is Understanding the Role of the Sports Massage Therapist. Now, since 2006, we have been sending sports massage therapists to games. And so sometimes there is a little bit of confusion as to what it is that the sports massage therapist does. We know that they do massage, but we are sometimes unclear as to the full scope of what it is that they're supposed to do. So my presentation will take you through that today. So an overview. So firstly, we'll be looking at the history of sports massage in Jamaica, the role of the sports massage therapist on the sports medicine team, the scope of practice of the sports massage therapist, and we will look at the various levels and the competencies that relate to the various levels of qualification. And then we'll look at the types of sports massage and the benefits, and finally the question and answer section. So there are a few objectives after the end of this presentation. So you'll be able to, 1, recall the history of sports massage in Jamaica. 2, value the role of the sports massage therapist on the sports medicine team. 3, identify the scope of practice of sports massage therapists. And 4, differentiate between the different types of sports massage. So firstly, I'll look at the history of sports massage in Jamaica. So Gerald Claude Foster, he is no relation to me, or not that I know about at the moment. He was a very, very popular sports massage therapist and a coach in the early 19th century. And so at the 1948 Olympic Games, he was actually identified as a masseur and a coach. And so Foster's granddaughter, she recalls that he never got tired and he could go into the night massaging people until sweat poured down his face. So Gerald Claude Foster was actually one of the first persons that was identified as a sports massage therapist. So in 2004, the GC Foster College introduced a short sports massage program. And so this program was developed by Ms. Sawyer Forbes. And shortly after, in 2006, Jamaica named its first sports massage therapist to a national team, and this was to the World Junior Games. And around 2010, GC Foster introduced its 2-year diploma program that is now an associate degree. And so massage therapists have been named to travel with teams to all major events. And so what exactly is sports massage? So sports massage is defined as a collection of massage techniques that are performed on athletes or actual active individuals. And this is used in aiding in recovery or treating certain pathologies. And so sports massage therapists are trained in assessment, rehabilitation, as well as the treatment of musculoskeletal injuries, injury prevention, and chronic care using various modalities. And so over the years, various techniques have been developed to help to complement an athlete's training program and to make sure that they are ready for competition. And so sports massage therapists can assist the athletes in various ways. One is what we call pre-event preparation. So it's the massage and the stretching that they can get before competition. You have the recovery period, which is after the event, and we'll call it post-event massage. We have maintenance during the training period, as well as rehabilitation after an injury. And these will be looked at in detail further on in the presentation. And so after looking at this, we can say that the sports massage therapist is therefore an invaluable member of the sports medicine team. And so we know that we have all of these sports massage therapists out there now. And so there are different qualifications that you can obtain. And based on the qualifications, there are various competencies that are related based on the qualification that you have. So currently, GC Foster just introduced their Bachelor's of Science in Sports Science, where you can either major in sports massage therapy or fitness instruction. So the first cohort of students would have started last September. Currently, we have the associate degree in sports massage therapy, which is a 2-year program. And then there are the short courses. So we have level 1, which is basic sports massage, level 2, intermediate sports massage, and level 3, which is advanced sports massage. Each of these levels are covered in 45 hours or 8 weeks. So now we're going to be breaking it down according to level and the competencies attached. So level 1, which is basic, they're required to work under the supervision of someone who possesses a certification of level 2 or higher. They are able to perform various sports massage strokes, and they're able to use certain modalities, but they're limited to hydrotherapy, thermotherapy, cryotherapy, and basic exercise therapy. Level 2, which is called intermediate, they now employ the use of special tests and common assessment methods. They're able to design a treatment plan, perform advanced stretching and strengthening techniques. They can refer a client to an appropriate health professional when necessary. And they can also use various modalities, but again, they're only limited to hydrotherapy, thermotherapy, cryotherapy. And the difference now is that they can actually use acupressure for treatment. Level 3, which is the advanced level, will have all the competencies of level 1 and 2. And now they employ the uses of myofascial release and trigger point therapy. The associate degree, they will have all the competencies of the level 1 to 3. They can perform all duties without supervision. And then they will do gait assessment, postural assessment, and functional tests. So now we understand based on the level of certification that somebody has in sports massage, then we know what their scope of practice is, what it is they can and cannot do. Finally, so those who hold a level 3 associate degree or Bachelor of Science or equivalent certification shall not use the following modalities unless trained and certified by an accredited institution. So any forms of electrotherapy, instrument-assisted soft tissue mobilization, or any form of joint mobilization. These modalities are not covered in the associate degree, so students are required to get training outside of GC Foster College at an accredited institution in order to practice these modalities. Sports massage therapy, so we're going to be looking at what's outside the scope. This list is not exhaustive, but it covers some of the main areas. So regardless of the level of qualification, they shall not, 1, provide any diagnosis to clients, perform the duties of other healthcare professionals unless they're otherwise trained and certified in that area. And finally, no high velocity, low amplitude techniques. These are strictly prohibited for sports massage therapists. Finally, we're going to be looking in depth at the types of sports massage. And as I said earlier, there are 4 types. We have prevent, post-event, maintenance, and rehabilitation. So the first one, prevent. So this is given shortly before the athlete is going to complete, preferably before they warm up. Some studies will tell you 1 to 2 hours, and some say the night before they actually compete is the best time to give a prevent massage. Prevent massage uses brisk light strokes that last anywhere from 8 to 15 minutes. It's used to warm up the muscles and reduce muscle tension. So it is used in conjunction with the warm-up. Prevent massage is not a replacement for the athlete's warm-up. Second, we have post-event or recovery, and this is usually given 1 to 2 hours after competition. We want the body to get back to equilibrium before we give any kind of massage. So this will use slow light strokes and can range from anywhere from 15 to 90 minutes. And so this focuses on relief from soreness and stiffness and aids in flexibility. Next, we have maintenance massage, and this is usually performed at least once a week while the athlete is in training. And so this is where we use deep strokes that we use to relax and tone muscles. Finally, we'll have rehabilitation, which helps to speed up healing and reduce discomfort during the rehabilitation process. We do friction strokes to break up scar tissue and increase range of motion using various modalities. So again, there are 4 types, and prevent, post-event, maintenance, and rehabilitation. And so if you notice that each of them, so prevent is very short. It's not a long massage. Once we go past that 15-minute barrier, then we're going to start getting to the mode of relaxation, and the athlete is going to start feeling sleepy, and we don't want that before they compete, right? So prevent is brisk light strokes, right? 8 to 15 minutes. Post-event noise where you get a longer massage, anywhere from 15 to 90 minutes. Right, so focusing on restoring the muscle fibers, reducing soreness and muscle stiffness. So in conclusion, the sports massage therapist plays a vital role on the sports medicine team. Right, the sports massage is an integral part of athletic performance and injury prevention. So that's the end of my presentation. Any questions?
Thank you, Ms. Foster. Is there any questions for Ms. Foster?
Yes, I can't put, if I might ask a question.
Sure.
All right, yeah. We know that there's always some crossover or overlapping between what a massage therapist does and what a physical therapist does. You went through the slides very quickly, and I didn't really make a good note, but I'm just, if you could explain a little bit in your associate degree program, you mentioned the fact that part of the program allows the massage therapist to do gait assessments, and there are 3 things, one after a gait assessment, functional assessment, functional testing. Could you just elaborate a bit on that for me, please, as to what it is that you do, or when you would apply those?
Okay, so sports massage therapists, as a part of our training is assessment, right? So we have to assess athletes before we provide any form of treatment. So a part of that assessment is gait assessment. So it helps us to find out, if there are any muscle imbalances and things like that, so we can provide treatment or refer the client accordingly. And the same thing when you look at functional tests. So functional tests help us to decide if the athlete is ready to be back in the field of play or not. So what we'll do, we'll give them shadow exercises to do. And if any of these activities are done with pain, then we know that they're not ready to be back on the field of play. And we say, all right, then you need to go back to your physiotherapist or whoever it is that was treating you before to continue treatment.
All right. Okay. All right. When you say assessment, are you talking about range of motion, muscle testing?
Yes. So a full assessment would include special tests, girth measurements, leg length discrepancy, gait assessment, pain assessment, and range of motion and strength tests.
All right, thank you.
You're welcome.
Thank you, Ms. Foster. Any other question? Yes, go ahead.
I think someone's hand is up.
Yes, Ms. Simpson, go ahead.
Jordan.
Very
Go again, Jordan, not hearing.
presentation. I'd just like to follow up. Are you hearing me now?
Better, yes.
Hello, are you hearing me?
Better.
Yes. Okay, I would just like to follow up on the question that Dr. Ratri asked. When you do special tests, what type of special tests do you do? And when finding out this information now, what do you do with it?
All right.
In terms of special tests. So give me an idea of the types that you would perform.
All right, so we do special tests for the major joints like the knee, shoulder, elbow, wrist, and hip. So we do for the shoulder, like we do Hawkins Kennedy test and scarf test and so forth. So what this enables us to do is to ensure that we're treating the right condition, and we can use modalities that can actually help to improve these conditions.
When you say, sorry, when you said to improve the conditions, are you talking about you're going to
musculoskeletal
exercises? You're going to give them exercises?
So a part of our training is one of the things that we do is exercise therapy. So we can now recommend exercises for persons to do based on the injuries that they have, or based on the findings of the assessments, I should say.
And so you would be working along with a coach, a trainer?
And as well as a team physiotherapist.
Okay. I think Parent Brown, you have your hand up. Is there a question?
Good afternoon. Good afternoon, everyone.
Afternoon.
Ms. Yvonne, you stated that it was not within the scope of practice of the massage therapist to diagnose. Other than being on a team per se, massage therapists in Jamaica work on their own, some of the, well, quite a lot of times. But then you go on to say that based on your assessment or the person's condition, you would then recommend exercises. You did not state that in your scope of practice. One, that you assess, you diagnose. Two, that you are able to prescribe exercises. For those listening, massage therapists are unlicensed health wellness professionals, because if they're not licensed, then we classify massage therapists as wellness professionals and not healthcare professionals. How then is it that you would go or get into recommending exercises for clients?
All right, so to start from the beginning, so as I did say, we're not allowed to diagnose, but we can assess, right? And a lot of the clients that we have are usually referred from the physiotherapist. So we want to confirm what it is that the physiotherapist says wrong with the athlete. So we do our special test, and if the physiotherapist says, oh, this client has an impingement in the shoulder, then we will do our special test to confirm that it is in fact an impingement in the shoulder. The physiotherapist would have also given recommended exercise already. So we want to ensure that we're still on the right track in maintaining the exercises that the physio would have given the clients.
Okay, and usually the referral does not ask for what the physio requires or the client requires.
Hold on, can you repeat?
And usually the referral from the physiotherapist doesn't come with a directive or ask what.
Yes, no, that's what I'm saying. So I said it does say, but we still have to confirm for ourselves.
Okay, I think what Dr. Ratri was getting at too was if you're using standard orthopedic assessments or special tests. I heard you mention a few of them, so I'm going to assume that you're taught orthopedic physical assessments and special tests.
Yes.
Okay.
We have one more question. I said Dana Donor had this up.
Good afternoon, everyone.
Good
Thanks for that presentation, Yvonne. I think there is a little bit of a tussle between us as therapists. I'm a physical therapist, as you know, and you as massage therapists. And if we as physical therapists are honest, we also do our special tests. We are not diagnosticians. But when the doctors refer patients to us, we have to assess for ourselves to ensure that what they're sending to us is what is actually in front of us. Because we understand that a lot of our general practitioners, especially, I mean, as somebody sent somebody to me with a hamstring strain, and they were actually having sepsis. So we still have to assess and call back the doctor and say, this is what I've seen or whatever. So I understand the position that massage therapists are in, and if they are trained in terms of special tests for different areas, then if they're trained in it and they can assess for themselves to see that this is what is happening, I think that they should be given the slack to at least be able to say, yes, this is in front of, and therefore I can go ahead now to do whatever it is that I'm trained to do.
Thank you for that. I do agree. It's important. So we're not taking away anything from what the physiotherapist is doing, but we have to confirm first that we cannot start a treatment protocol without first finding out what exactly the root of the problem is. And secondly, you might also find other things wrong with the client besides what the physiotherapist had referred to you, right? So the assessment is very important for us as well.
Thank you, Ms. Foster. Is there any more questions?
No, I think she has explained herself quite well. And I think we all have a better idea as to what the massage therapist can do, especially when it comes to helping to manage the athletes and their performance. And the teamwork that's required when we're working with athletes.
Agreed.
I think we're here now at the end of our session for the most part. Yes. Let me get back to my picture here. Where am I? Right, okay. The folks in Mandible side seem to be having some electrical issues. Oh, Dr. Jones, you're back? Okay.
Yeah, I've been back.
Okay, good.
Lightning knocked out the service, the internet and the TV, and the light for a brief moment. So the internet service has come back.
All right, so we've completed our session. All our speakers have completed, and therefore I would ask you to bring up the closing remarks and vote of thanks.
All right, thank you, Jones. First of all, I'd like to thank the Educational Committee headed by Joan and supported by Dr. Diallo Brown, Mr. Fabian Miller, and Jordan Simpson for organizing yet another Keeping Pace to help keep us all informed and up to date on the latest and ongoing trends in sports medicine care. Then I next thank the speakers, Dr. Hanson, for speaking to us on the coupling of exercise and good mental health. I thought that topic should have been expanded to probably good physical health as well, because apart from the mental side, we saw a lot of the great benefits of exercise on physical health, things like diabetes, obesity, and dealt with the mental health aspect as well. We'd like to thank Dr. Hanson for bringing us the intricacies of the whole thing and the whole physiology and biochemistry behind it, help us get a better and greater understanding of the whole process. And I'd like to thank Dr. Theon John Jones, dentist, for presenting to us an interesting topic which we often overlook as sports medicine practitioners. It was great that he was able to bring to mind all of this, the different aspects and the importance of proper dental health and how it relates to athletic performance. I never recognized that the whole swimming thing, have been someone who used to swim a lot, that the whole idea of rinsing your mouth after you come out of the pool, how important that was, because having taken care of a pool growing up, I knew that the pH is generally acidic, but I didn't recognize the importance of that and the damage of the teeth. Other great points of takeaway were like sugar-free gum, of course, chew stick, back to the roots, and the whole idea of preventing, screening, and treating. And I'm sure a lot of us will bring these concepts and these practices into our daily practice and treatment of athletes. I'd also like to thank Ms. Foster, Yvonne Foster, our presenter on understanding the role of sports massage therapists. I must say I missed most of the latter part of our presentation due to our lightning storm here in Mandible. But I did catch pieces of it, and the whole importance of the sports massage therapists and the whole ability and the whole importance of them to be able to think independently, you know, so that if there's something that doesn't concur necessarily with what they were sent there to be treated with initially by the therapist or the doctor, that they would have the frame of mind to be able to make their own assessment and as such coordinate with the relevant other parties to ensure that the athlete gets adequate treatment. I'd like to thank our moderators, Ms. Jodianne Simpson, who moderated the first session. I'd like to thank her for handling that smoothly and keeping it within the time frame, recognize the questions and answers, and executing all aspects thereof. Ms. Jean Williams Johnson and Mr. Fabian Miller for the same thing, for just coordinating the whole their sessions and making sure that they flowed appropriately and that they were kept to time. Next, I'd like to thank the sponsors, Mr. Paul Russell of Abbott Laboratories. Again, this kind of delves into the whole idea of sports nutrition and the whole idea of, well, ensuring, perhaps reminding us about your whole protein shake line, your Ensure, which a lot of our local athletes actually use when they're training as a protein shake. Remind us about Glycerna and Juve and other supplemental beverages that can be used to enhance one's nutrition in terms of and their training. I also thank Ms. Ketchup Braham, the Caramed rep who now oversees the Novartis line of anti-inflammatory medications. I'd like to thank her for her concise presentation and reminders on the drugs that we are very familiar with and we use pretty much every day, Cataflam, Voltaren, and the various presentations or formulations of those products. And then finally, I'd like to thank you, the attendees, if you're still there. Thank you for attending our Keeping Pace seminar for the month of September. We had over, well, I think our limit on the Zoom is 100, and then we had about 5 or more persons who spilled over to the YouTube channel because they probably weren't able to access us via Zoom. I'd like to thank all those who have attended both on Zoom, via YouTube. Without you, we'd just be presenting to an empty room or an empty space. Our next Keeping Pace is in November the 7th. Will be hosted by the Central Chapter of the Sports Medicine Association. The topics and speakers will be sent out at a later date, so keep your ears open, and we welcome all of you back to attend that session when it is available. Thank you all, and keep safe, stay COVID-free, and have a good evening.
All right, thank you, Doc.
Persons have been asking about the certificates for CMEs for all current paid up Sports Medicine Association members. An effort will be made to send off their certificates as soon as possible, and there is no fee for them. For all other persons, there is a fee, a small fee of $500 for the CME. I will send my email address in the chat box. You can just email me your request and I will send you the banking information for a direct transfer to be done.
Joan, somebody was asking if an in-person payment could be made. Sorry, any ideas?
In person, who will see Joan directly? Visit Joan directly and pay her directly?
No, to a member of the association.
And then that person, member of the association, will transfer the money.
Right. She said a doctor from, I'm not sure where she's from. She said she's old-fashioned. She doesn't do online banking.
Well, she pays a member who then deposits the fund to the account, and then that receipt is transferred to Joan to confirm payment. Then sure, whatever way you can confirm the payment, whether it's via direct deposit or via indirect deposit through a second party.
Second member. Oh, okay. Okay, that's what I.
Yeah, but as long as it's identified and confirmed by a reputable person.
Okay. All right. Thank you.
Okay.
Joan,
you're muted, Joan.
You're muted.
I'm putting some information here that where a payment can be made to the treasurer.
Okay.
Who is Carrie and Gordon Simmons at the physiotherapy department on University Hospital of the West Indies.
Okay.
That's another
option. Okay. All right. Because she was asking about the sports medicine unit at the hospital.
No,
okay,
different entity.
No, I said I'd find out. Right. I said I'd find out if any of our members were at the sports medicine. Okay. All right.
Diallo is no longer at the. Diallo, speak for yourself. Are you still working?
Right. No, Diallo has run off to UTech.
Yeah, that's what I'm saying.
But no, if I'm available though, if I'm available, they can still reach me. But I was thinking I'm seeing persons putting their email addresses. But Joan, it might be easier if you put your email address and then the email.
You ask for them to put their email address here?
No, they're putting their addresses there now. I'm suggesting that maybe you.
I mean, to collect the email address from the chat.
Who are showing email addresses, maybe you. No, right. They have to collect your email address. They're gonna email.
I put the email address in.
Here already.
I put my email address in the chat.
They should email Joan, not send their email. They should email Joan directly and then communicate with them. So it's not for them to put their email address. They email Joan directly, and then Joan will honor their request based on provided the various criteria.
So Joan, can you
send it again?
Okay. Send your email because I'm not seeing it. If you send
it, there.
It's there, but it's got pushed up.
Yeah. I'm gonna write it again. Okay.
So we just ask persons again. If you need the certificates, just email Dr. Joan Rattray, and she will follow up. We'll all follow up. Thank you.
And I think both emails were in the initial invitation to the meeting, both Dr. Rattray
Yes,
and
I believe so too. Yes.
Right, it was.
Well, thank you, folks. I think this was a great session. I'm glad we hit the 100 mark. I think the first time we've had all 100 persons attending on Zoom, and we've had a few on the YouTube. And I look forward to seeing you all again come
November.
November. I think Piran, did you
November
want to say
7th is the date.
the
November
date?
7th.
7.
Hi, everyone. This is Kiran. November 7th at 2 p.m. is the date for the Central Chapter's PACE seminar. The topic will be on blood flow restriction training or therapy or rehab. We'll have exciting presenters from the chapter as well as a marketing rep from Delphi Tourniquet Systems and Owens Recovery Sciences in the US will be presenting on the topic. It's a new modality, and hopefully it will be exciting and interesting for all. Thank you.
All right, great.
Okay, I've sent the information off to the person who inquired.
Who was asking. All right, okay, folks. We're going to bring the session to an end. Have a good afternoon. What's left of it? Get some rest, eat some food.
Yes, fixing my dinner now.
For those who are staying home for lockdown, rest. No movement day tomorrow and Tuesday for some, and not for others. All right.
Okay, thank you. Good night. Stay safe, everyone.